I read a story in the Horses and Humans Research Foundation Fall 2008 newsletter about a 13-year-old girl named Sherry who had cognitive disabilities. She went to the Hippotherapy Center once a week as part of her therapy treatment. One day she came down to breakfast and told her mom that she was going to have a great day and make a 100 on her test that day. Her mom asked, "Well, how do you know this, Sherry?" And she said, "Well, I went riding yesterday and I rode Robert, and Robert always makes my brain work better." Sure enough, she came back that day with a 100 on her test. We're beginning to hear more and more stories about children who were once very disabled improving both physically and mentally with the use of hippotherapy or treatment with the use of horses. Unfortunately, many doctors don't believe that hippotherapy is an effective form of treatment due to the lack of research available on it. With some help, we can prove them wrong. But before I tell you how that can be done, I need to clarify what hippotherapy is. The American Hippotherapy Association defines hippotherapy as a treatment strategy used by physical, occupational, and speech therapists to improve neuromuscular function by the use of equine movement. More simply put, hippotherapy is the use of horses in rehabilitating patients with muscular and cognitive disabilities. As part of a treatment program, therapists use horseback riding in hopes of reaching functional goals. The American Equestrian Alliance says physically, hippotherapy can improve balance, posture, mobility, and function. Hippotherapy may also affect psychological, cognitive, behavioral, and communication functions for clients of all ages. The patients are assigned to a horse based on their needs and experience. They have a special mounting block and they ride on a pad that has stirrups attached. The special pad allows heat to rise from the horse to relax the muscles and then stimulate them. While the riders are sitting on the horse, they have to use core muscles that are needed in everyday life for balance and to remain sitting upright. They do their exercises and play games from on top of the horses. The American Hippotherapy Association also said that the horse's walk provides sensory input through movement, which is a variable, rhythmic, repetitive motion. The resultant movement responses in the patient are similar to human movement patterns of the pelvis while walking. The movement and heat of the horse, as well as the sights, sounds, smells, and textures of just being around horses and being outside, can help kids who have trouble staying focused listen better to directions just by providing the right amount of stimulation. The parents of 5-year-old Steven said, besides his new joy of horses, animals, and the calm outdoor setting, he has improved his attentiveness, his willingness to follow directions, and his interactions with other children and adults. Doing therapy with kids can a lot of times be very frustrating, both for the kids and for the therapist. It's not exactly easy to keep a small child focused on the exercises you want them to do, especially when they can be very painful and pretty boring. Putting a child on a horse allows them to do something fun during their session that they don't normally get to do, and it's helping them without their knowing. While a disabled child or adult can't do many of the things their peers can, like riding a bike or playing sports, hippotherapy gives them a chance to do something their peers won't ever get to do. Being around animals and riding horses gives them the opportunity to live a little more than their disability would normally allow. To the parents of and those who participate in hippotherapy, the benefits and effectiveness are obviously apparent. Doctors have yet to share in their enthusiasm and can't see the value of using horses. The medical community places hippotherapy in the alternative medicine group because of the lack of research available. Doctors, though, used to think that chiropractic and osteopathy were also ineffective treatments, but they are now considered effective treatments of therapy. The Horses and Humans Research Foundation has begun its work on studying and researching hippotherapy, but it needs financial support to continue its endeavors to make hippotherapy a valid therapy treatment. It is important that the rest of the medical world sees the difference hippotherapy can make in disabled kids and adults. Please consider donating monthly to the Horses and Humans Research Foundation by signing a commitment form at the back of the room. By donating, hippotherapy can get the respect it deserves so kids like Sherry and Steven can live a more normal life.